Hello and welcome to everyone who's joined us this afternoon to our education session on supporting younger colorectal cancer patients. My name's Catherine and I'm the Director of Services and Support at Bowel Cancer UK, and I'm delighted to have been asked to host and chair this education event for you this afternoon. It gives me enormous pleasure to introduce our speaker for this afternoon, and I'm delighted to welcome Beth McCann. So Beth is Senior Specialist Nurse for Teenagers and Young Adults with Cancer at Oxford University Hospital's NHS Foundation Trust. So big hi to you, Beth, and welcome, and thank you for sparing the time.
Thank you. Thank you for inviting me to come and speak. So it's a pleasure for me to be here today. So I'm just hoping that my slides are going to come on. There we go. So I just wanted to sort of highlight to you. I can see that through the chat that lots of you are colorectal nurse specialists. So I am clearly not a colorectal specialist nurse, so you guys know far more than me about that. But what I can talk to you about is looking after young people with cancer, as that's something I've been doing, oh gosh, for the best part of 30 years now. So I've been a specialist TYA cancer nurse for 21, 22 years. And, you know, I absolutely love my job, and that's why I've been doing it for so long, because I really love working with young people with cancer. So I just wanted to talk to you a little bit about that. So these first few slides are a little bit about the stats, so I'm not going to dwell for too long on these, because you can always refer back to them. But just to point out that around 2,400 young people are diagnosed every year across the UK with a cancer diagnosis. But cancer in that age group, so up to the age of 24, only accounts for less than 1% of all new cancers in the UK. And also, just to point out, obviously, I'm sure you know this, but the older that you are, the higher the incidence is. So from the age range that I look after, which is up to their 25th birthday, the highest rates of cancer are between the ages of 20 to 24. So this slide here is just looking at it from a slightly different perspective. So usually when we look at cancer stats, we're looking at it from a population perspective. But Professor David Walker has done some work recently looking at the actual risk to the young person. So, so by the age of 1, you have a 1 in 4,500 risk of getting cancer. By 5, that increases to 1 in 1,000. By 10, that's 1 in 600. By 15, that's 1 in 400. And by 24, your risk of getting cancer is 1 in 200. And I think it's interesting to look at it this way, because we're always told, you know, cancer in young people is so rare, and it doesn't seem rare to me because it's all I do all day, every day in my role. But, you know, for lots of other people, they think that cancer in young people is rare. And I guess it is compared to, you know, cancer in older people, but 1 in 200, I mean, everyone knows 200 people. And so I think that a lot of people might be shocked by that. So just to sort of highlight briefly the most common types of cancers that are diagnosed in this age group. So lymphoma is by far the most common type of cancer that we see in young people, and then you can sort of see down the rest of the types of cancer. We don't see that many cases of bowel cancer in young people, and so they are grouped in with the other category down at the bottom. And this is just looking at survival, really. So survival, and this is looking at all types of cancer that young people get. So I think on the whole, young people tend to do better than older people, but looking at a 5-year survival, about 87% of young people that have cancer will survive their cancer 5 years later. By the time that reaches 20 years, that drops off to 74%. And then this just shows the survival amongst the different types of cancer. So for example, with lymphoma, we have like a survival rate of sort of 96, 98%, whereas when you compare that with something like liver tumours, the survival rate is around 40%. So just thinking about specialist services and why we are here, why I do the job that I do. So it's well recognised and well documented now that young people with cancer need additional support. There's wide recognition that young people with cancer have specialist needs that differ to both those of children and that of older adults. So this was first highlighted actually in the Platt Report in 1959, where back in those days parents weren't allowed to visit children in hospital and young people, and children were actually often nursed on adult wards. So that was kind of the first report that addressed that. And then in 1995, the Kalman-Hein report first acknowledged the specific needs of young people with cancer. Moving forward a few years, in 1990, Teenage Cancer Trust was actually established, and they opened the first ever teenage cancer unit in the Middlesex Hospital in London, where I was fortunate enough to work for many years. Just to say really that the work of Teenage Cancer Trust since then has just been phenomenal, really, because it started with the opening of a specific teenage cancer unit, as I say, in the Middlesex Hospital in London in 1990. And now across the UK, there's actually across England rather, that's very different. In England alone, there are actually 13 units that have like a specialist unit. So it's like a ward just purely for teenagers with cancer. So we're going to come to that a little bit later. And then in 2005, the Children and Young People's Improving Outcome Guidance also made key recommendations, sort of suggesting that young people with cancer needed access to specialist principal treatment centres. And then kind of since then, back in 2021, we've had the Improving Outcome Guidance from NHS England, which also lays out service specifications, of what is required when looking after young people with cancer. So what is it that the teenage and young adult specialist team do? So thinking about, so I've just mentioned the designated units that are in the principal treatment centres. So as I sort of said to you before, these are specialist units that are kind of custom built specifically for young people with cancer. I'm just going to skip forward a slide for a second because I've got some photos to show you. So this is what like a typical young person's cancer unit looks like. So probably quite different from the sort of adult sort of oncology wards that perhaps you're used to. So the three pictures that go over the top, that's of where I used to work in London at UCH Hospital. And these are just sort of different areas for young people to sort of hang out. The one in the middle is a picture of the day room where they can just go and chill out and play Xbox, PlayStation, listen to music, watch DVDs, whatever it is they want to do. They've got the jukebox there. And then the bottom ones are some pictures of wards, kind of what an average room looks like on a teenage cancer unit. So just moving back to my first slide. So what is it that we do on these units? So we have specialist nurses such as myself. We also have youth support coordinators. So they're people that are able to provide activities and resources, like doing craft things, stuff like that. So they can actually go and visit these young patients in their rooms and provide things for them to do to help relieve the boredom. And in doing that, they kind of tend to build up quite trusting relationships, and often the young people will open up and speak to them. We also have access to Young Lives versus Cancer social workers. I hope that you will have heard of Young Lives versus Cancer, because anybody that's diagnosed with any type of cancer up to the age of 25 should hopefully have access to a Young Lives. Well, they are definitely entitled to access to a Young Lives versus Cancer social worker, but it needs a referral from somebody to Young Lives versus Cancer, and they can be a tremendous sense of support, which I will come on to a little bit later. And I've also put down there psychologists. So usually as part of a TYA service, we have a designated TYA psychologist, because I'd say probably at least more than half of our young patients end up needing to speak to a psychologist. So we work alongside the young person's treating teams. This varies actually because it's quite tricky depending on where you work. So I'm currently based in Oxford, and so we don't actually, unfortunately, have a teenage cancer unit. It's something we've been trying and fighting to get for several years, and I'm hoping that someday soon we will have one. But most of the other principal treatment centres in England do have designated units. And when I worked at UCH in London, we didn't work alongside treating teams because we were the treating team, if that makes sense. So all the consultants that I worked with only looked after young people with cancer. So we would have, for example, an adolescent haematology consultant who looked after the young people with leukemia. We'd have an adolescent and young adult oncology consultant that kind of, and they're also kind of specialised in various things, and then clinical nurse specialists that work alongside those teams, but all part of the TYA team. So we didn't actually have site-specific teams that we're working alongside because we did site-specific work. So back then I was actually an adolescent haematology nurse specialist for a while, just looking after young patients with leukemia, whereas now my role is I look after young patients with any cancer diagnosis up to their 25th birthday. But yeah, so now working in Oxford, I do work alongside the treating team. So for example, if we have a patient here that is diagnosed with colorectal cancer, then they would be under the treating team of the colorectal team, and they would have hopefully a colorectal CNS, and then I would just kind of, our team would just work alongside to support them. So it's not that we kind of go in and take over it. Our role is supporting that young person, ensure they receive age-specific care, etc. And I'll come on a little bit more to what else we do. We also provide care which extends beyond the direct focus of the young person's treatment. So, I mean, basically, what that means is that we really get to know these young people. We work with them. We see them every time they come into hospital. We build trusting relationships with them. They open up to us, and we're very fortunate in our role that we do actually have the time that we can actually give to these patients. Because I know that working in the NHS now, it's very difficult, and that's something where we are blessed that we do have the time that we can spend with these young patients. So we support them through the pathway from diagnosis, through treatment, and into follow-up. So thinking about the TYA multidisciplinary team. So, I mean, every young patient that is between the ages of 0 and 24 that has a suspected cancer diagnosis must be referred to a principal treatment centre. So I think that this obviously works very differently from how when adults get cancer, they often get treated at the nearest sort of hospital, whereas how it works with young people is, I've told you that in England there are 13 principal treatment centres. So if you're under 18, you absolutely must be treated in one of the principal treatment centres. You can't be treated in any other hospital. It has to be one of those hospitals. If you're between the ages of 18 and your 25th birthday, you must be referred to the principal treatment centre and then given the choice as whether or not the patient would like to be treated in the principal treatment centre or treated in another designated hospital that might be nearer to home. Regardless of where the patient is treated, they should always be referred to the TYA MDT. So even if they're not being treated in the principal treatment centre, they must come through our TYA MDT. And this is because we want to kind of discuss their case, make sure that they're given age-appropriate care in a safe and effective manner. When they come through our sort of service, it increases the likelihood that they'll participate in clinical trials. So it's ensuring that they have access to those trials. It increases the tumour banking rates. We also feel that we give like an improved experience of care because of our sort of TYA, the things that can add and the value that can add for a young patient. Obviously, because of our areas of expertise, we meet their informational, educational and psychosocial needs that are specific to their age range. Also, we're very kind of unfortunately, used to dealing with patients that are non-compliant in one way or another. So we're used to kind of working with young people around those issues. So ultimately, we want to help the young person to navigate these challenges, ensuring that they have optimal delivery of safe and effective care. And obviously, as with any MDT, we discuss the patients from a range of viewpoints and have regular professional discussion and shared learning. So thinking about what impact a cancer diagnosis has on this particular age. So having cancer at a young age comes with its own particular set of challenges. So we all know that adolescence is a really challenging time anyway. Young people are undergoing rapid physical, cognitive and psychological and social changes. So they're going through a phase in their life, where they're trying to establish their own independence. So it may be that they've just moved out of home away from their parents, they're living at uni, or they've got a job and they're living on their own for the first time. They're forging their own identity, and that includes sexual identity and gender. Planning careers, forming relationships. And again, this is something, the area of relationships is something that can be quite tricky. And I think it mentions there somewhere that I do have a specific interest in sexual health and fertility. And this is primarily because when I first started looking after young people with cancer, years and years ago, there wasn't any information at all out there for young people about their sexual health, and is it safe to participate in certain types of activities, and what information we should be giving young people. And that's something that since then I have done a lot of work on, and I'm often asked to talk on that subject, and I can talk for at least hours actually on that. So I'm not going to have time to go into great detail in that, because I'm just trying to talk about what support is available for young people. But if anybody does have any questions, my contact details are at the end, and I'm happy to pass on any information and share any of the work that I've done on that. Yeah, thinking about relationships, lots of young people come to me and say, I'm ready to start dating now. A lot of young people don't want to even think about dating till after they finish their treatment, but sometimes their treatment might go on for years, and then in that case they might want to think about dating. And you would not believe the amount of dating profiles that I've helped to write, one of which included putting on their dating profile that they had cancer, because this young person was sick of being rejected when she eventually told somebody that she had cancer. So she wanted to get it out there from the start and say, look, I've got cancer. If you can't deal with it, don't contact me. And obviously that approach might not be right for everybody, but that's what she felt was right for her in the end. Yeah, so a cancer diagnosis poses a major threat to them accomplishing these important tasks. And after having cancer and after finishing their treatment, young people find that their lives have changed quite significantly, and often they can't actually pick up where they left off. So they have to adjust their sort of prior hopes and plans. And it's kind of part of our role is about helping them to find a new normal. So yeah, so at the top there, I've just put, so at a time when young people should feel more connected to their peers, they often feel disconnected and isolated. So then this can then lead to poor mental health outcomes. As I mentioned previously, a lot of the young people I work with do suffer with their mental health in one way or another, and a lot of them do need psychological support. We've seen a massive increase over the last few years, and certainly since COVID, and the impact that has had on our young people's mental health. I mean, a lot of that was to do with the fact that, when there was no visiting allowed for these young patients, we had a few that literally just turned 18 and were stuck on an adult ward and not allowed to see their parents. And it was, I've been doing this job a long time, but for me, that was the hardest point in my career, having to keep parents and their children apart at a time when they'd just been given really bad news. So that I found that quite difficult. Thinking about body image, obviously that is a big concern. Lots of these concerns apply to people of any age, but I'm obviously got my young person's hat on. But body image for young people is huge, and it really does affect them. Things like, I mean, if they have surgery and they have lots of scarring, a lot of them are concerned about that, where they have lines in and taken out, they get scarring from that, never mind sort of surgeries where they may have amputations and such. Also, simple things like being put on steroids. As you know, they put on weight mainly around their face and their abdomen. And the amount of young people that have got sort of, because they tend to put on weight quite quickly with the steroids, so they end up with quite severe stretch marks. Sometimes they're so bad that they're really angry and red and really sore. And then they will end up having those often for the rest of their life. And the amount of times I've had, young people come crying to me because they're going on holiday and they couldn't possibly wear a bikini with these really angry stretch marks, etc. So that can be quite traumatic for them. And then of course hair loss, which is absolutely huge for them. I don't want to say it affects girls more than it affects boys, because it can affect, it can affect. I've seen it have really negative impacts on both, but I mean, often it can be very distressing, to the point that it's been said to me several times when I've gone to see a young person, I've said, what is it that's concerning you the most? What is it that you're most worried about? And the amount of times that young people have said to me that the thing that they're most upset about, and this is over and beyond being told that they have cancer, they said that they're most upset that all their hair is going to fall out. And this actually, sometimes can upset them more than the fact of knowing that they have cancer. We've talked about loss of independence, so that can be really difficult, going from sort of living on their own to being sometimes back in hospital with a parent literally in the bed next to them, helping to wash and care for them and get them up to the toilet, holding vomit bowls while they're sick, etc. It's just such a huge change, and young people find this very frustrating. Obviously, it can have a negative effect on their education, so whether they're at uni or whatever it is that they're doing, this can put them back quite a lot, and sometimes they have to drop a year and redo a year, etc., depending on their individual circumstances. We've mentioned briefly intimate relationships. Again, this can be difficult because, if you're not already with someone in a relationship and you want to date somebody, at what point is it the right time to tell somebody that you have cancer? And this is something that I've discussed a lot with young people, and there isn't really a right or wrong answer because it's different for every situation. So part of my role is kind of, working with these young people and sort of listening to them and sort of helping to advise them on what might be best in their individual situations. Obviously thinking about the impact that a cancer diagnosis has on the whole family, and particularly siblings, because I've seen it so many times, the siblings of the person that has cancer, the parents will often say, no, I'm sorry, I can't come to your football match, Joe's in hospital. Well, I can't come to your school play, we're going to see Joe in hospital. Can't do this because a lot of the focus is on their sibling who has cancer, and that can be really hard for that young person. So that has an effect on the whole family dynamic. I've obviously mentioned there as well about patients that are actually young parents themselves and have their own children to worry about whilst they're undergoing chemotherapy treatment. So I'll leave these for you to read. These are just a couple of comments from young people that I've worked with that wrote these in their sort of patient participation survey. So I just wanted to show you this slide. So I'm not sure if you will have heard of this event that's put on by Teenage Cancer Trust. It's called Find Your Sense of Tumour, and it's an event that runs once a year, and it's kind of run as a conference style event. So it's run over a few days, usually 3 days. So it'd be like Friday, Saturday, Sunday. And during the day, it's kind of like a conference style where you have various speakers come in. So I've kind of put a little excerpt there so you can see part of it. So for example, Professor Alan Pacey always comes and does a session on fertility, which the young people find really invaluable, and they get to ask questions related to the specific type of chemotherapy that they've had and how that might affect their fertility sort of in the future. There's lots of other sessions that go on, so that tends to happen during the day. There's also things like they get to go off swimming somewhere and they can have some what's it called, like aromatherapy or relaxation treatments or massage, something like that. And then in the evening they tend to do fun things like have a DJ, so they'll listen to music and kind of, you know, all get together and do that kind of thing. There's a picture at the bottom there. They're often asked if they want to do a showcase where they can showcase some talents. So some people sing, some people dance, some people tell jokes, you know. But it's just, I mean, I've been to Find Your Sense of Tumour many times, and it is an amazing experience, because you have like 200, 300, sometimes 400 young people with cancer all in the same room, and it's so powerful, because sometimes these young people feel so isolated and feel like they're the only one that's going through it. Like I'm talking about people of their own age. So for them to have the opportunity to meet other young people and get that peer support, it's really, really incredible. And they also do a thing where they can, if they want to, they can choose to wear a wristband, and it's the colour of the disease type they have. So for example, if they have leukemia, they can wear a red wristband, so they can look out for other people that have red wristbands, because the likelihood is they will have had exactly the same treatment, so they might want to go and talk to them, etc. I was asked to kind of mention financial support for young people, and I have to say that this is not something that I'm particularly an expert in, and that is because we have such amazing Young Lives versus Cancer social workers that we work with. So as part of our TYA team, we have a Young Lives versus Cancer social worker, and that's what he is completely expert in. He goes and talks to, so if we get consent from the young person, sort of say, is it okay if Mark comes to speak to you from Young Lives versus Cancer? As soon as they say yes, then Mark can go and speak to them. Immediately they get access to a grant of £100 that gets paid directly into their bank account within a matter of days. So that's just, you know, like a registration grant, if you like, from registering with the Young Lives versus Cancer. Then Mark will often apply, if they need a Macmillan grant, Mark will apply for a Macmillan grant, which, as you know, that's about £350. There's also other grants that our social worker applies for, things like financial hardship grants, crisis grants, bereavement grants. He'll also help them fill out their PIP applications. I don't know if any of you ever filled out a PIP application, but that can be really, really hard work and very arduous, particularly for young people. So Mark will often sit with them and actually do that for them. The same goes for universal credit. He's an expert when it comes to giving advice regarding what they're entitled to in terms of their employment. He knows a lot about employment law and sick pay. So, for example, I had a patient recently who was really upset because they obviously had to give up work because they were having treatment for cancer and undergoing chemotherapy, and they were told by their employer that they weren't entitled to sick pay because they hadn't been there long enough or something. Anyway, Mark went and met with this family and this young lad, and basically said to him, no, that's wrong, and you are entitled to sick pay because you earn over £120 a week, or whatever the reason was. And he actually spoke to the employer on the patient's behalf and actually got that all sorted out for him, to make sure that he was getting what he was actually entitled to. So Young Lives versus Cancer are really a huge asset to any family, because it's more than just the financial side. They basically do support in all other ways that isn't medical, if you like. So obviously our role is to give medical, clinical sort of advice and support, whereas their role is kind of everything that's non-medical. So for example, if they need a letter writing for their employer, or if they've had a flight that's cancelled due to insurance reasons, Mark can help out with all of those types of things. But also he's another ear, somebody, because he goes to see the patients regularly, they build up a trusting relationship with him, and it's just somebody else that they can turn to and someone else they can talk to. I've put at the bottom there other charities, and I'm just going to flick through this slide very quickly. I mean, we work with so many charities. So these are just some of the charities that we work with, and I'm sure that you will have heard of some of them. So we do the special days for our young patients, and they're actually, so the Willow Foundation, I'm sure that you know this, but they will provide a special day for anyone up to their 40th birthday. I've had a young girl recently, she wanted to go on a spa weekend, and so they paid for her and 3 of her friends to go all weekend to a spa place and have various treatments and pampering, and she enjoyed that, and that was amazing. There's things like the Youth Cancer Trust holidays. Now they go up to the 30th birthday. So again, that's like a free activity holiday, so the young person with cancer can go away, and it's all fully paid for by that charity. And there's all these other amazing charities. I mean, there's Shine Cancer Support, so they go up to 40s as well, 20s, 30s, 40s. They support people up to those ages. I just wanted to talk a bit about communicating with young people, because it can be complex at times. Sometimes it can be really difficult. The amount of times I've gone into a room and I just get grunted at. But having said that as well, sometimes, I mean, I met a new patient last week, oh gosh, and they would just chat, and they were absolutely delightful. So, you know, it does vary from person to person. And it's just really about kind of taking each person as an individual and not giving up on them. I actually looked after a young lad who died recently, and every time he used to come into hospital, I would pop down and see him, and I'd sort of say, you know, is there anything you need? Is there anything I can get you? And if he needed something, he would tell me, and then I'd kind of get on and do it, or if he needed a scan changing, etc. But I really felt like I hadn't really done much for him compared to, you know, what I do for the other patients, because he didn't really ever want to talk. And then he was in hospital. He was in the hospice, actually, in the hospital when he died, and I was visiting him every day, and some days he didn't really want me to be there, and other days he just wanted me to sit with him. And you know, he said to the consultant one day, you know, the TYA team have been amazing, and I don't know what I'd have done without them. And I remember sitting there thinking, you know, oh my goodness, we literally haven't done anything. Sometimes we just pop and say hello, and he doesn't want to talk, and then we go away again. And I think that really showed us, you know, it was the consistency of us going and not giving up on him, and sort of keep going back to check up on him. And he really valued that. So he wasn't really a big talker, and he didn't like to talk much, but he really valued knowing that we were there for him. I've put at the top there about giving information at a rate that the patient can absorb it in a language they can understand, and in a form that is meaningful within their own social context. And this is really, really important, because sometimes I'll go to see a young person and they'll say, well, the doctor just came in and talked a load of gobbledygook, and they get sort of quite frustrated because they feel like, you know, that they don't really understand. And sometimes they don't want to say that they don't want to understand, because they don't want people to think that they're stupid. When I worked in London, we did a lot of work around sperm banking, and it was sort of my role to speak to all of the young lads about sperm banking and telling them what was expected of them, what was going to happen, what they needed to do. We audited that quite extensively and got the views of young people. And they were very, very clear that language is incredibly important. So in the first lot of paperwork we did, I think it said something like, you know, you need to masturbate and, you know, you need to ejaculate and masturbate into a specimen pot. And they all came back and said, well, half of them, I don't know what that means. And it sounds too clinical, and you know, it's not in a language that we use, and so I don't really get it. So in the end, we ended up changing the paperwork, and when we speak to them, you know, we used to say, what you need to do is you need to have a wank in, and you need to come into this little pot. So it's using language that they're familiar with. I mean, I once saw many years ago somebody come back with a urine sample after they were supposed to go and do sperm banking, and again, that highlights sort of the poor communication. So communication is really important when talking to young people. I put there about not making it task orientated. That's really important to young people. The amount of times people have said to me that that they appreciate somebody coming to talk to them and seeing them as a person. So it's not just about, oh, have you got a temperature, or what does your poo look like today? Because they get sick of being asked that. They want someone to ask them how they are, what they've been up to, what their interests are, what about the football match that happened at the weekend. And, you know, I know and I do appreciate that it's difficult sometimes to find the time. And I guess that's where I'm lucky in my role, that I do have the time where I can, you know, talk to the young people that I work with. And I've put at the bottom there, sometimes it's not about problem solving. Sometimes they just want to talk and they just want you to listen. So thinking about the top tips I've put there, internet access. So when they're in hospital, if they don't have internet access, then your life is going to be a living nightmare, because I'm sure for those of you that have teenage children, I mean, I have 3, and when I moved house recently, we were without Wi-Fi for 2 days, and you'd think it was the end of the world. I've put there about being mindful of your own professional boundaries, because sometimes it is hard when you're working with young patients, and I see it on the ward sometimes with some of the younger nurses that are of a similar age. You know, it's very hard. It can be really hard for them, but I think, you know, for your own protection as well, and to sort of prevent burnout and sort of compassion fatigue, it's really important to maintain those boundaries, including online. So I say to the nurses here, you know, you cannot be friends with someone on Facebook, you can't be, you know, communicating with them online. As I mentioned, developing an understanding of each person as an individual. This next one, showing flexibility where possible. So this is something that my adult colleagues come to me in utter frustration, and they're like, Beth, you have to deal with this because I can't deal with it anymore. When some of the young people that I work with, for example, one of my colleagues might have booked a scan for them, and then the young person was like, no, sorry, I can't do it that day, and I can't do it this day. I can do it after 4 o'clock on that day, or I can maybe do it at 3:30 on that day because I'm at university. And so my sort of adult counterpart colleagues come to me sort of pulling their hair out, because it's very difficult when you have to try and keep changing appointments for young people. And obviously in the adult world, I guess that doesn't, I can only assume, I've never really looked after sort of elderly people, but I would imagine that elderly people, if you give them an appointment, a lot of the time that they would say, okay, thank you, I'll be there for that. Whereas with young people, it's kind of all about them. I mean, I'm currently looking after a girl who I've been looking after for about 4 years now, who has incurable cancer, and she's very much, no, I can't do it this day, I've got a uni exam that day, I can possibly do maybe the week after that, you know, and it's but you know, she does have incurable cancer, and she has a goal in her life that she wants to get her degree from university, and she's been having treatment on and off, well, pretty much on for the last 4 years. So she's had surgery, chemotherapy, radiotherapy, ablation, more surgery, lung surgeries, you know, so lots of things. So she's always in and out for scans, hospital appointments, bloods, and she's backwards and forwards from uni, and her life is so interrupted by her treatment for cancer. So, you know, trying to see that whole picture and imagining, if that was my family member, what would I want somebody to do for them? And so sometimes we do go out of our way to kind of change appointments, and I know it can be frustrating for people, but it's really important when we're working with young people. This is a part of what kind of TYA, the TYA team do for young people. Allow and encourage them to take control of decisions wherever possible. Understand that there may be conflicting views with parents and young people. Often parents will say to me, you know, please don't tell my young person that whatever it is, whether it's they're going to die or whatever it is. And, you know, it can be a difficult subject, but ultimately, you know, we have to say to the parent, you know, my responsibility is to the young person. And if they ask me something, you know, I'm not going to lie to them. You know, we can say it in a gentle way, but sometimes it can be tricky working with parents. And I'm sure that can be true, working with relatives of any age, that can be difficult. Give consistent and sound advice. I'm sure that you've all had patients that will ask someone something, and if they don't get the answer they want, they'll ask someone else and they'll ask someone else until they get the answer that they want. So it's trying to be consistent at all times and make sure that everyone is giving them the same message. It's about setting expectations and make sure, you know, that they don't expect something that's completely unreasonable. When we make promises to young people, it's about making sure that we follow them through, otherwise they'll lose trust in us. Helping the young person to identify and strengthen their supports, encouraging their social contact and peer support. This is hugely important. And before COVID was a thing, we used to encourage them to bring their friends up to the ward so that they could actually see and appreciate what it is that they actually have to go through when they're undergoing their treatment. But obviously that's been made a whole lot of difference now since COVID. Encouraging and maintain a sense of normality, vital to essential coping. I've put in there about risk taking. So we know that, that young people that have had cancer are more likely to undertake risky behaviours. So it's, you know, part of my role is discussing that with them and having frank communications. So whether that be sexual risk taking or drugs or whatever it may be, it's about sort of keeping those lines of communication open. Making time for the family, keeping them informed and making them feel included, also considering the needs of the wider family and partners. And the other thing, I don't know why I haven't put it on there, is you know, one of the things that is obviously hugely important is making sure that the care that we provide is inclusive. So not making any assumptions about a person's gender, about a person's sexual orientation. And when we're talking to the young people, because we should all be counselling our patients about their sexual health and giving them advice about how to participate in safe behaviours. So yeah, it's not making any assumptions. So never saying to somebody, oh, do you have a girlfriend or do you have a boyfriend? You know, it's about, are you in a relationship? Are you having any type of sex? Those types of questions. So I've come to the end of my time. So just to summarise really, having a cancer diagnosis at any time is obviously devastating, but for people, for young people, when they're undergoing all of these changes in their life already, it's quite a huge thing for them, and it shouldn't be underestimated. Negotiation, choice, information, promotion of independence are crucial to assisting the young person into having some degree of control. And then I've put there that, you know, once they finish their treatment, it all just doesn't disappear. And some people actually really, really struggle. Some people sail through their treatment, and then when they get to the end of their treatment, they just completely fall apart and really suffer with their mental health. And so part of our role is trying to support them through that, because, you know, for them, life doesn't go back to normal. And it's really about trying to help them find their new normal after they finish their cancer treatment. So thank you for listening to me. And I mean, that was a very kind of whirlwind tour of looking after young people.
Beth, brilliant, thank you. Loads in there. We do, I'll do another shout out for questions because we have got a little bit of time, but we have had a couple come through. So one of the questions we had was from someone saying, I've got a patient who's in their early 20s and who's thinking about starting a family and was in the middle of having those, you know, sort of conversations before their diagnosis. How would you suggest approaching the conversation with them around fertility, and where would you signpost them to?
Yeah, so I mean, I suppose, I guess I don't understand the individual situation, but if somebody has a cancer diagnosis, so we would discuss fertility right up front before. So if we know that we're going to advise to give them any type of treatment that is likely to affect their fertility, we should be having discussions with them up front about their fertility and what their options are. So at the time that they're, if they're advised, for example, that they need to have chemotherapy treatment, and we know that that might affect their fertility, they should be counselled on that and then given the options as to what might be available. So, I mean, I guess we all know that for young women, one of the obvious options is egg harvesting. And I know that for some types of cancer, like, for example, if you have leukemia, or there's certain types of cancer where you can't do egg harvesting, and it's not sort of, it's not an option. But something that can be done is they can have ovarian tissue cryopreservation, which is a simple procedure. Or I say it's a simple procedure. It is an operation, but it's a simple operation that can be done sort of within one day in their home the same day, and that can be stored down and cryopreserved until such time when they might need it. Then it can be the tissue can be reimplanted so that they can actually gain their fertility back. And this is the same for the men as well. We can do testicular tissue cryopreservation, which is different from sperm banking. And that can also be done for men, that can also be done after they've started chemotherapy, because obviously sperm banking cannot be done after they've had any chemotherapy whatsoever, whereas testicular tissue cryopreservation can be done several months after they've had chemotherapy. So I'm not sure if that answers the question. But
that's great. Thank you. Really, it's fascinating area. And then another question that actually comes up quite often for us in our patient communities, where people are asking us for support. So I thought, well, I've got you here, I will just see if you've got anything to add to our standard answer. And that's about younger patients and managing stomas, and obviously sort of some of the particular challenges that they might face and where you might signpost to for support. So we would signpost people to Colostomy UK who have a really brilliant junior ostomate support line, and you can be part of their junior ostomate community. And I just wondered if there was anywhere else that you would recommend.
I mean, I guess when I've supported young people that I've been working with that have stomas, I generally refer them to our stoma specialist nurses, because they're the ones that tend to obviously know more about that specific thing. So yeah.
That's great. Thank you. Well, we've come to the end of your bit, so I just want to say a massive thank you to you, Beth, for taking the time out to talk to us this afternoon. I can see from the comments in the chat that people have been sending you lots of thank yous, so we'll make sure that you get all of that, and then we will send round the recording link to everybody after the event. So a huge thank you from all of us at Bowel Cancer UK to you, Beth. So without further ado, just leaves me to say a massive thank you again to Beth, our speaker, for her talk and for the opportunity for people to ask her questions. I also want to thank all of the Bowel Cancer UK team who are hiding behind the scenes, who are bringing this event to you this afternoon. So that's all from me. Take care.